Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Tapeworm infection symptoms and treatments. Tapeworm eggs in the stool of a person infected with tapeworm can be transmitted to others. Tapeworm infection occurs by swallowing tapeworm eggs, which can get into food from improper food handling. /r/n/r/n The worms live and grow in the digestive tract and can spread to other parts of the body. Tapeworm infections are uncommon in the United States and tend to occur more often in parts of the developing world due to contaminated and undercooked meat or fish. When an infection does occur, it is relatively easy to treat. /r/n/r/n This article looks at the symptoms and causes of tapeworm infection and what is needed to diagnose, treat, and prevent taeniasis. /r/n/r/n Tapeworms are a type of parasitic flatworm. They have a head, a neck, and a body consisting of many segments called proglottids. The proglottids may contain eggs. /r/n/r/n Tapeworm infection can be classified as either intestinal infection or invasive infection. Intestinal infection that occurs with any of the three Taenia species results in a condition known as taeniasis. /r/n/r/n The pork tapeworm can cause cysticercosis, an invasive infection that has spread to the brain, muscle, and other tissues. The parasitic larvae escape the intestinal tract to form cysts in other parts of the body. Infection by larval cysts in the nervous system Neurocysticercosis is a serious condition. /r/n/r/n You aren't likely to see an entire tapeworm in your stool. Once it's been treated, the tapeworm detaches from the intestines and dissolves before it leaves your body. Sometimes eggs or segments of a tapeworm, called proglottids, that pass out in bowel movements can be spotted. However.rnrn/r/n In most cases, infection with a tapeworm causes few or no symptoms. In fact, many people with taeniasis do not even realize that they've been infected. /r/n/r/n If there are signs and symptoms of taeniasis, they may include /r/n/r/n Neurocysticercosis can cause headaches, seizures, and confusion. /r/n/r/n An untreated infection can also lead to vitamin B12 deficiency, which, in turn, can cause anemia. This condition can occur when your body lacks enough healthy red blood cells to carry sufficient oxygen to the tissues in your body. /r/n/r/n Signs and symptoms of anemia can include /r/n/r/n You won't be able to feel a tapeworm while it's in your system. However, you may be able to feel one as it passes through your anus during a regular bowel movement. /r/n/r/n With certain types of tapeworm, such as those that infect pork, the larvae can move out of the digestive system and form fluid-filled larval cysts in other body parts, called cysticercosis. This may result in masses or lumps under the skin or in body tissues or organs. /r/n/r/n If cysts develop in the central nervous system or the brain, there can be neurological symptoms referred to as neurocysticercosis. In severe cases, this condition can be life-threatening. /r/n/r/n Some tapeworm species can get rather big. Pork, beef, and fish tapeworms can grow between 15 feet and 30 feet long. Not all achieve these lengths, however. The aptly named dwarf tapeworm doesn't grow longer than 2 inches. /r/n/r/n Many cases of taeniasis are asymptomatic, without symptoms. If you experience any of the signs or symptoms of tapeworm infection after traveling to an endemic area, seek medical attention. /r/n/r/n This is especially true if you experience any of the rare signs and symptoms of cysticercosis, including /r/n/r/n Tapeworms don't usually cause complications. However, if neurocysticercosis occurs and is left untreated, it can rapidly turn deadly, leading to meningitis, hydrocephalus, water on the brain, seizures, and dementia. Even so, death from neurocysticercosis is rare, with only 211 deaths reported in the United States between 1985 and 2011. /r/n/r/n Several species of tapeworm can infect humans, including /r/n/r/n infections are more common in the developing world in areas where sanitation facilities are lacking and people may be in close contact with animals. Tapeworm infections in humans occur most often as a result of eating undercooked or raw beef, pork, or fish from an animal that was infected. /r/n/r/n Another cause of infection is poor hygiene after coming in contact with tapeworms or tapeworm eggs. Poor hygiene can be improved with proper hand washing, for example. This is why it is important to wash your hands with soap and water after using the toilet, after changing diapers, and before preparing food. /r/n/r/n Eating undercooked or raw meat, pork, or fish is the most common way that people are infected with a tapeworm. If the animal had tapeworms, the person eating the meat can also become infected. /r/n/r/n The life cycle of a tapeworm begins with eggs. Tapeworm eggs can live outside of a host and in the environment, such as in water or on plants, for days or even months. Animals may become infected after eating plants or feed or drinking water that contains tapeworm eggs. /r/n/r/n Once inside an animal host, the eggs hatch and mature into young tapeworms. The worms are mobile and can migrate out of the intestine and into muscle tissue. /r/n/r/n If not frozen or cooked properly to kill the worms, the animal's meat contains living tapeworms. They then can be passed on to a human who eats the meat. /r/n/r/n A less common way of becoming infected with tapeworms is through contact with eggs from the pork tapeworm, Tesolium. The eggs are shed in the stool of an animal or a human who is infected. /r/n/r/n The eggs can remain viable in the environment, including in water. This is why it's important to ensure that the water you drink is germ-free. /r/n/r/n The eggs can also be spread if an infected person doesn't wash their hands well after going to the bathroom and then handles food that is eaten by others. /r/n/r/n Pork tapeworm eggs can also live on surfaces. It's possible to become infected through the use of objects such as dishes or silverware that have eggs on them. /r/n/r/n While infection with tapeworms does occur in the United States, it is more common in the developing world. Travel to areas where infections with tapeworms are common is a risk factor for people in the United States diagnosed with taeniasis or cysticercosis. /r/n/r/n Cysticercosis mainly affects subsistence farming communities in developing countries of Africa, Asia, and Latin America. /r/n/r/n Diphyllobothrium infection is prevalent in Northern Europe, Russia, Canada, Africa, Japan, Taiwan, Manchuria, Siberia, Papua New Guinea, Australia, and South America. /r/n/r/n Diagnosis of infection in the digestive system includes testing the stool for tapeworms and/or looking at the anus area for eggs. Some people may notice tapeworms on or around their anus. A healthcare practitioner should see them during a physical exam. /r/n/r/n Edreshka, Getty Images /r/n/r/n In some cases, tapeworm segments may be visible in the stool. If this occurs, it is important to take a stool sample to a physician or a lab to get it tested. /r/n/r/n A stool test can determine which type of tapeworm is present. It might be necessary to collect and test stool from several different bowel movements over a few days to make the diagnosis. /r/n/r/n Blood tests for vitamin B12 levels and/or anemia may be done if there is an infection with the fish tapeworm. A blood test that looks for specific antibodies may be used to help diagnose cysticercosis. /r/n/r/n Imaging tests such as a computed tomography, CT, scan or magnetic resonance imaging, MRI, may also be done if there are complications from an infection with pork tapeworm eggs that have migrated to other parts of the body. /r/n/r/n Unfortunately, tapeworms don't just go away on their own. If a tapeworm infection isn't treated, the parasite is likely to stay put. Depending on the type of tapeworm, you may never know it's there. /r/n/r/n In cases of intestinal tapeworm infection, treatment requires a medication that will immobilize the worms. Once the worms are unable to hang on to the lining of the intestine, they will be passed out of the body during a bowel movement. /r/n/r/n Biltricide, praziquantel, is an anti-parasitic drug commonly used to treat tapeworm infections. For infection with dwarf tapeworm, H-nana, a medication called Taenia, nitazoxanide, may be appropriate. /r/n/r/n For complications from infection with pork tapeworm eggs that have formed cysts, treatment will depend on the location of the cysts. It may be necessary to use medication or another treatment to manage the infection and associated complications in other areas of the body. /r/n/r/n This video has been medically reviewed by Casey Gallagher, MD. /r/n/r/n Since the majority of tapeworm infections are the result of international travel, it is important to adhere to infection control practices when traveling to areas where tapeworms are endemic, widespread. /r/n/r/n This includes parts of Africa, Asia, and Latin America where there is subsistence farming, meaning nearly all of the crops or livestock raised are used to maintain the farmer and the farmer's family. /r/n/r/n In order to prevent tapeworm infection while traveling abroad, /r/n/r/n Unlike some infections, a tapeworm infection does not afford you immunity to repeated infections. Reinfection is common if strict infection control practices are not maintained while in endemic regions. /r/n/r/n Tapeworms are parasitic worms that can infect the digestive tract. Pork tapeworms can even move out of the gut and form cysts in other parts of the body, including the muscles and brain. /r/n/r/n The most common way to get tapeworms is by eating infected beef, pork, or fish. Washing your hands is important, especially in areas where infection is common, because it can help prevent transmitting tapeworm eggs in stool to other people. /r/n/r/n Diagnosis may involve an exam, stool tests, blood tests, and imaging. The infection is manageable and usually treated with medications that cause the worms to be passed out of the body. It's important to get the infection treated to prevent serious complications. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.